Hi, this is Jessica May, and this is my presentation on my first synthesized findings on how physical and sexual abuse affect childbearing women and precautions practitioners should take when caring for survivors. Titles and study designs. My first study is Mental Health Demographic and Risk Behavior Profiles of Pregnant Survivors and Childhood Adult Abuse. This is a prospective longitudinal study, cohort qualitative and quantitative study that is a descriptive analysis and survey medical record data. My second study is the reenactment of childhood sexual abuse and maternity care, a qualitative study. It is a feminist interview narrative study with thematic analysis. And my third study is risk factors and mental health during pregnancy among pregnant women who previously were exposed to sexual violence. This is a qualitative, registered-based cohort study and statistical analysis. A summary of my study findings. In the first study, it found that women who are victims of abuse, both physical and sexual, were more likely to develop post-traumatic stress disorder, depression, and or anxiety. They were more likely to participate in recreational drug use. That includes illicit drugs, alcohol, and tobacco, and therefore were at higher risk of pregnancy complications. Survivors were less likely to disclose their abuse to their providers. Of a study of 377 women, only 18 disclosed to their providers about their abuse. In the second study, it discovered that there are 5 categorical headings that are more likely to trigger reenactment for past abuse. And that's intimate procedures, such as cervical exams, pain, such as contractions, loss of control, interactions with strangers, and unexpected triggers. And we found that most unexpected triggers were behaviors that mimicked that of their abusers. And in our third and final study, it found that survivors of abuse were more likely to use tobacco products or drink alcohol, both prenatally and postnatally. They were more likely to suffer from obesity, gestational diabetes, preeclampsia, or hypertension. So my synthesized findings for these studies were that there is an increased risk in maternal mental and physical health if she is a victim of physical or sexual abuse. Therefore, it is very beneficial for the practitioners to ask the mother if she has a history of abuse. A lot of times we do ask if she has anxiety or depression, but having that barrier of knowing whether or not she is a victim of abuse impairs us to address those. So it's good to ask, and mothers can determine for themselves whether or not disclosure of past abuse is too painful for them. Practitioner awareness should be followed up with an awareness that allowing mothers more control of their care is beneficial to both the practitioner and the mother in this instance, such as allowing the mother the benefit of aborting mission during a cervical exam. So here are my references for the studies, and thank you very much.